Hi, it's Ashley, and this is my Case of Seth video. So when comparing the psychosocial responses and the rehab of both the sport-related concussion and the musculoskeletal injuries, both of the processes can take a lot of time, and they're not always easy to understand. There are a lot of things that might pop up that patients don't understand right away and take a lot of explanation. And both injuries can elicit feelings of frustration or anxiety in terms of how the condition affects their ability to perform, even once they return and when they can return. So additionally, they both consider factors that may predispose individuals to these conditions. However, they are different in terms of the weight of the factors of those predisposing factors. So often the psychosocial responses to concussions are more of a focus because of the nature of the injury involving the brain. So pre-existing conditions such as depression, anxiety, or stress may prolong the recovery longer compared to that of musculoskeletal injuries. We learned a lot about it in our eval classes, that we ask the psychosocial questions, but they might not play as big of a role in recovery compared to the concussions. So then athletic trainers have the ability to play a role in diagnosing injuries or conditions and creating and applying their rehab for those injuries. So when we're working with other healthcare professionals, we are very flexible and accommodating, and we both work to get the best outcome for our patients. And depending on the specialties of those other professionals, athletic trainers, like I said, are very flexible and can find ways to help where they're needed. Because there are obviously components outside of an AT's scope of practice to provide effective and comprehensive care, it's important to include, important to include a mental health professional. Mental health is an area that ATs aren't strongly educated in, other than recognizing the red flags and knowing when to reach out for professional assistance from those that are more qualified. Additionally, it may help to have a nutritional expert and even those that may practice non-traditional medicine, just because everyone has unique preferences through rehab and recovery that ATs might not have access to. So it's always good to have others that are more qualified in those areas than ATs.